Hello, everybody. Welcome to Community Spotlight hosted by CASA of Tulare County. I'm Alberto Ramos, the Executive Director at CASA, and I'm here happy to be joined by our friends at Tulare County Health and Human Services Agency. I'm very grateful to step into this and be a caretaker of these relationships and be a caretaker for an organization like CASA and help move it forward through the challenges that lie ahead.
Well, we definitely are unique in Tulare County, in my opinion, and we've talked about this in many of our meetings and gatherings, right? We're pretty blessed to live and work and serve in a county where, as you're saying, the partnerships are just so molded together. And it really is a leave your logo, leave your ego at the door mentality. And really, what can we do? What are we here for? And how do we join forces to do the best we can to fill the gaps in our community? So one of the things that, as you know, that you guys are involved in behavioral health, child welfare strong, and many other partners are involved in is the building out of our child, youth, and family wellness system. And that's a new effort here in Tulare County. But we're really looking forward to the change that we can bring here and bringing people together to really look at specific services and impact to those children and families that are involved in child welfare and behavioral health.
One of the, highlight a recent conversation that we had and again, the relationship and the importance of partnership. We had a situation where, we're always constantly identifying and assessing for gaps and needs. There's certain limitations and I guess mandates that we have to do, yet the child may have other needs that child welfare, behavioral health can't fill. And so we had a situation where children that are needing to have their immigration status adjusted, and there's a cost or a fee to that process. It's not a requirement of child welfare services, and we want to support the child through that. However, we can't fund it, we can't pay for it. And so for Alberto to step up and say, you know what, we can support a child and a youth through that process and pay for that. And so really appreciative of that process. And it just speaks to, yes, that relationship and the collaboration to say, you know what, we're going to put this child in the middle, at the center, at the forefront, and really look at, what are their needs, and how can we all come to the table and work together to be able to identify those needs, gaps, and obviously have them fulfilled and have the child be successful in whatever it is that they're doing. So
It's a duty, right? It's my pleasure. I would have said it's my pleasure, but it's my duty also, right? But I'm happy to be able to be in a position to be able to do that. And I think something you said, reminded me of how our partnerships, governmental and nonprofit partnerships, can be like a force multiplier, right? So we're able to accomplish more through these partnerships. Nonprofits can generally be more nimble and agile in meeting needs, right? And CASA, I believe, is in terms of nonprofits, CASA is uniquely positioned to be able to do that with the dependency system, the juvenile dependency system, with our partners at child welfare. And so it's really a duty that we be able to meet the needs of these kids, the most vulnerable in our county, in our communities. So yeah.
and as you were saying, Fran, with our child, youth, and family wellness system, part of that is information sharing, right? And so being able to make sure that we're able to communicate with one another, share information that's vital to the success and outcome of this child's and youth's well-being. And so that's the important piece of all of us coming to the table, being able to say, okay, how can we do this? Because it's not something we can sit around and talk about all the obstacles, all the challenges, and why we can't do something, and we could all take turns and then just spin our wheels. However, when we want to look at solution focus and be able to say, okay, how can we work together and what can we do to overcome these challenges and barriers, as a system, to be able to support our family and youth. And so that's something that I'm appreciative of the relationship with behavioral health, with CASA, and then all of our other partners as well.
Yeah. One of the things that I think that we've been doing a really good job of and we continue to do and make improvements on is the ability to allow someone to walk through any of our doors, tell their story, and make an immediate connection with other resources, whether it's any of us sitting here or, like you said, any of our other nonprofits or business partners, to really limit the number of times they have to continuously tell their story, to really limit the amount of additional trauma they might have to experience as an individual or as a family, because all of that comes with their own set of emotion on top of everything that we're trying to do. So really respecting the space that they're sitting in and having that mutual respect between all of us that are working together to where it really, again, doesn't matter who does what, but understanding each other's strengths and weaknesses, understanding what we bring to the table and how we can serve each other. So that way we can do a warm handoff wherever possible, to say if we get a new child and they need a CASA or they need diapers or they need something, even the immigration piece that Gilberto touched on is who do we turn to where we can do a warm handshake off and they don't have to reiterate everything starting from scratch again. So it's one of the things that I appreciate a lot about you and your team is they really do come to that table open-minded and open-hearted more than anything, and they want to look at that full ability because CASAs and your volunteers is one piece of what you do, but what we see also is a piece in the hearts that your staff and you bring to the table of what else can we do to really serve them, whether it's helping out with understanding a Medi-Cal application or really looking at what other services are available to them, and behind the scenes you guys are making connections so that they don't have to do it on their own.
I think it's so important to understand each other's systems. And I think one of the secret sauces that we have in our county is a lot of us have worked in multiple systems. And so we understand what it's like if a family has to walk into child welfare, where child welfare understands what it's like to have to go and turn in an application for aid or access mental health, what that looks like. And so a lot of our staff can speak to that and take away that fear. And you do such a great job in your trainings. I went through the 40-hour CASA training way back when, and you do such a good job of bringing in all the different partners to speak to that. So the CASA advocate knows, like, hey, it's, we'll just go to one door. Like you said, Fran, we can go through this door and they can link us to where we need to be.
That's awesome. And that's another highlight to or testament to the collaborative spirit, right? That we have a staff person from child welfare coming to our training on a Saturday, right? Like on a Saturday. So it's amazing to me. I'm very grateful for that. Nobody's ever said, "Hey, you owe us money," or "No, we're not going to do this." You change when we change our trainings from to try and facilitate it for the community. We used to say, everybody from the far reaches of Tulare County, come to Visalia, two evenings,
Yes.
2 evenings per week for 5 weeks, and you're going to be going home after 8:30. And if you live in Porterville or past that way, you're going to be getting home late, right? So bad weather, all these things. Well, when we changed it, thinking, how do we activate more community members to do this work, right? Because it's important. It takes community. It takes a village to look out for kids that are in these vulnerable situations, right? It's our societal duty to do this for them. So we had the obligation to change our training. And when we went to weekends, I thought, oh, I hope we don't lose this, because that's a key component of our training is these professionals that we're going to be, as CASA is going to be interacting with, right? And so it was very heartwarming to hear from our team that, hey, everybody says it's fine, they can keep doing it. And so it's very, very cool.